When we think about breast cancer, the majority of breast cancers worldwide, and I should say breast cancer is the most common diagnosis of cancer worldwide after skin cancer. And so important for your female listeners and male listeners to pay attention to, because men can get breast cancer as well.
Yeah.
We know that I would say at least 80-85% of breast cancers are driven by the female hormone estrogen. So we all have estrogen in our bodies, women. Even when we're postmenopausal, we still have estrogen. And unfortunately, excessive estrogen is a risk factor for breast cancer. And so if you think about the adipocytes, which are the cells that comprise fat, one of their skills is making estrogen. So that is one of the purported mechanisms, in addition to thinking about insulin-like growth factor, inflammation, oxidative stress, et cetera. Just the fact that there can be estrogen production by these fat cells, unfortunately is likely one of the mechanisms that can increase risk for breast cancer. And we also have to think about, where's the fat located? I mean, we have fat in different parts of our body that has different properties and behaviors. And this is another area that's of great interest by scientists. But you think about visceral fat, which unfortunately, if that's the fat sort of in our midline and abdomen, that can certainly increase after menopause. We think about fat in the breast itself, and then other stores of fat in our body. And these may all have different mechanisms that can explain how these obesity can increase risk for breast cancer. I should note that obesity is a risk factor for postmenopausal breast cancer. So I think that's important for us to keep in mind as well. Interestingly, in premenopausal women, obesity is not a risk factor, and understanding the mechanisms for that is also a really interesting area for research.